Acne scars is something that anyone with acne has experienced at least once in their life. And just like acne, you need to know what type of acne scar you're dealing with in order to get rid of them. What's up guys, welcome back to my channel. If you don't know who I am, my name is Bahar and I'm excited about sharing my knowledge and personal experiences about skincare with you. If you haven't already, make sure to hit that subscribe button so you too can join our community. Scarring after a breakout is considered something extremely normal and just like acne, it can have a negative effect on your mental health, on your self-esteem, because I personally have experienced it and am experiencing it at the moment. And I remember back in high school when, well, I was breaking out more than I am right now. I felt very insecure about my acne and my acne scars. And I remember when I entered college, I would not leave the house without any amount of makeup. And that was because my acne scars were having a very negative mental toll on me and I just didn't want to show them. But now, even though I still don't really feel good with the acne scars that I have learned to embrace them and just accept the fact that, okay, it's something that is going on and it will go away eventually. If you want to treat your acne scars but you already have active acne right now, I suggest you take care of your active acne before you take care of your acne scars because, well, your acne scars are not going anywhere, but treating your acne is going to be much easier than treating your acne scars. When it comes to acne scars, they are divided into two categories. The first category is more of a discoloration rather than a scar, but the second category are actual scars. Starting with the first category, the first one is post-inflammatory erythema. This is the most common type of acne scar you will see, which happens right after your acne, and they are red spots that you see on your skin. They will go away eventually, maybe after a few months, and if you want to speed up the process, you can use any ingredient that has brightening effects like vitamin C or niacinamide, or you can use exfoliants like glycolic acid to slowly remove the dead skin cells, which will in turn get rid of that spot on your skin eventually, or you can speed up the, well, skin cell turnover process with using retinols, or you can use any other product that says it has a brightening effect. For example, right now I am using the XSY brightening serum. I can see some difference in my acne scars, but it has only been maybe a week or so, and I really can't give a major comment about it. But for now, my acne scars are fading away faster than they normally do, so these types of scars are easier to get rid of, and they can be gone sooner by using skincare products that have brightening effects. Next is post-inflammatory hyperpigmentation. Now, these are a bit darker than post-inflammatory erythema, and they are mostly seen in people with darker skin tones. They are going to go away on their own, but they are a bit harder to get rid of, and they might take a few months or up to a year in order to disappear. But they have the same treatment as post-inflammatory erythema. You can use exfoliants, you can use brightening ingredients or brightening products or even retinoids in order to get them to go away. But something to keep in mind is, even if you want to speed up the process, don't go overboard, because all of these are actives, maybe not vitamin C or niacinamide, but exfoliants or even retinoids. They are actives and they can severely damage your skin and your moisture barrier. So if you go overboard with these, not only are you trying to treat your acne scars, but you also have a damaged moisture barrier on your hand, and until you repair that, you cannot use any other active. So the treating your acne scars is going to be put on hold until your moisture barrier is repaired once more, and that is a process you do not want to go through because it takes some time in order to repair that, and trust me, it is not fun. So chill, it will go away, take your time, and don't go overboard. And the third type is post-inflammatory hypopigmentation. Instead of the skin getting darker, it turns white. It turns lighter than it used to be. And the reason for that is the attack on melanins, which is the part of your skin that holds color. So that area of your skin is going to turn lighter than the rest of your skin. And unfortunately, most times it is permanent, but there is a way to see if it is actually going to be permanent or not. See if hair grows in that area or the area around it, and whether or not those hairs have color in them, because the melanin in hair follicles can actually travel to your skin. Otherwise, unfortunately, that area is going to be white forever. You can get it treated by a plastic surgeon or a dermatologist, but other than that, it's going to stay white. Now, next category are actual scars. Scars that are left by extreme trauma to your skin, maybe an extreme infection like cystic acne. These types of scars are not going to go away on their own, and they need to be treated by either a dermatologist or even a plastic surgeon. There are some at-home treatments that might say they can help these types of scars, and they may actually help it maybe a little bit, but they're not going to be as effective as clinical treatments. So don't get your hopes up when you see at-home treatments that say they are going to work for these types of scars, because in the best case scenario, they're going to help maybe 5 to 10%, not that much. First scar type is atrophic scarring. These scars are small dips into your skin that happen after, like I said, an extreme inflammation like cystic acne, and unfortunately, like I said, at-home products or over-the-counter products are not going to help with these types of scars. The reason for that is that these scars are happening way deeper into the skin and in deeper layers, and well, because of that infection, that trauma, that scarring has happened throughout the layers of your skin. And at-home treatments or over-the-counter treatments are not designed to penetrate your skin that deep, because, well, they are not safe for you to use on your own. That's why you need to see a dermatologist in order for them to use products or methods that are going to penetrate your skin to that level, that deepness in your skin, in order to treat them. One of the most common ways that you can treat these types of scars is microneedling. Microneedling is when a needle is being poked into your skin over and over and over again. It doesn't sound fun, I know, but microneedling can be very effective for these types of scars. The reason is this poking motion is going to, well, make your skin produce more collagen, which in return will fill in these dips into your skin. It is also good for anti-aging purposes, and it will help your skin to repair itself on its own. And you can do microneedling at home, but most of the microneedling objects that you see on Amazon, they normally have a depth of 0.5 millimeters to maybe 1 millimeter or 1.5, which I really don't recommend because that is way too deep to be used at home. And even if you use them, they are not going to penetrate your skin as deep as it needs to be, and that penetration should not be done at home. It should be done under the supervision of someone that is a professional. Next is chemical peels. Again, chemical peels are also something that you can get over the counter, but the ones that are going to be effective for your scarring are way too concentrated and way too strong to be done at home, because for these chemical peels, one wrong move or 1 second more can actually lead to severe damage to your skin and severe chemical burns. So even if you do get an at-home kit, it is not going to be as effective as a chemical peel that you do with a dermatologist. But nonetheless, they can be very effective because, well, chemical peels, especially ones that take the whole first layer of your skin off,
and
are going to help get rid of these dips into your skin and will help your skin to reconstruct itself in a way. Next is laser treatment. This is probably the most precise type of treatment that you can get done for your acne scars, because lasers are designed to do a specific type of treatment in a specific area. So you can get your treatment through a laser as well. But before you decide as to which treatment you should do, go consult with a doctor, with a dermatologist, or maybe even a plastic surgeon, because when you do a consultation, they will tell you which one of these treatments are going to be better for your skin concern, for your skin type, and which one of these is going to be more budget friendly for you, because these treatments can get real pricey real fast. And the second type of scars is hypertrophic acne scarring. This is a less common type of scarring compared to the other ones, but what happens here is that that area of your skin is producing too much collagen, which makes it into a risen scar. And in the other type of scars, we gave it more collagen in order to, well, get rid of those scars, but in this type of scarring, we need to calm it down in order for it to produce less collagen. Again, this is a type of scar that needs to be treated by a dermatologist. Sometimes they use a laser to remove it, or they even inject steroids in it to calm it down and get it to produce less collagen in order for it to go back down. So yeah, I know that acne and acne scars can have a major blow to your mental health and to your self-esteem, but just remember that no matter what you decide, if they stay or if you want to, well, let them be there. You are beautiful no matter what, and don't let anyone or anything tell you otherwise. I hope you guys enjoyed this video. If you did, make sure to thumbs up and make sure to check out the video where I talked about different acne types.